So my name's Alison Baker. I've been working here at Wilberforce College for the last 9 years, teaching health and social care. Prior to that, I've also taught in schools, I've taught in other colleges, so I've got quite a substantial background in teaching. But I also have worked in various different health and social care roles over the years as well. So I've worked with people with disabilities, mental health problems, elderly people with Alzheimer's. I've worked in children's hospital. I've worked in various different health and social care settings. So I sort of can bring that experience and those ideas, I suppose, and learning to my teaching. The Level 2 course itself is a 1-year course. But in reality, students would start in the September and they would finish all the coursework by the end of May, middle of June. And the actual course content, there are 2 exam units. So they'll look at human lifespan development from babies through to old age. And the different ways that things out in the world affect individuals and their growth and development. They look at healthy living in the other exam unit. And then there are 4 coursework units because not everybody's as confident or as good at doing exams. A lot of people prefer to do coursework. So we have a lot of it is the basic underpinning knowledge that you need for working with people, whether it's little people or older people. So we do a unit on care values, which is about respecting people, confidentiality, equality, dignity, safeguarding, really important obviously to keep people safe. So there's that unit. There's unit 3, which is about communication skills. So they'd learn about communicating and also alternative methods of communication as well for people who have visual impairments and hearing impairments. We look at how you can pick up on and understand people, so you can maybe get a picture of what's wrong with them, how they're feeling through their non-verbal communication, so picking up things from their body language and everything else. So that's another really important unit that underpins everything. There are probably 3 main options that people go for. One is to continue and progress on to the higher level course, the Level 3 course, having done the Level 2. And that can be either in health and social care, which would then allow them to go to university, to go on and do social work, teaching, nursing, lots of different careers in that sector. But if they do the Level 2 and partway through they think, I don't think this is really for me, then that's okay, because they can go on to do any other Level 3 course in another different area of the college. So we always would say, it's never a wrong choice. People don't have to worry about, I've made the wrong choice, I don't really want to do this. It's absolutely fine, because the important bit is to continue to get that Level 2 qualification, because then that opens up doors to go and progress onto Level 3 qualifications in any different subject area that people choose. So that's one option. There is apprenticeships. Some students like to look at apprenticeships. Obviously there's not so many available just now, but some students have gone on to look at apprenticeships and do those in the past. And the other thing is that a Level 2 in health and social care actually does give people a qualification that they can use for work, for employment. So some of our students have then gone straight into employment in care settings as a qualified member of staff. So we have set a piece of work for our students to complete over the summer before they come to us. So they will hand it in either when they come to enrol, and then we can pass it on to the relevant teacher who will be teaching the course that they're enrolling onto. Or they can bring it with them on their first day when they start college. So it's just something that we use and that we expect students to have done to show that they're committed and interested in the subject area. The piece of work that we've set involves a bit of research, a bit of just knowing the area that you live in. So what we've asked people to do is to imagine that you are advising somebody who's age 65 plus, so an older adult, about what health and social care services are available in the local area. So maybe imagine that somebody's just moved into that area and they don't know where anything is. So they will need to know about the healthcare services. So maybe, what doctor's surgeries are available, are there health centres, what sort of provision and facilities are available in those health centres. What about the hospitals? Where's the nearest hospital if they needed those sort of facilities? But also things to do with people's general well-being as well. So maybe are there any daycare centres? Are there like drop-ins? I know that near me there's at the local church, in the church hall, they have lunch clubs and coffee mornings and needles and pin sessions where people can go and do sewing and knitting and things like that. So it's that kind of information.